Thyroid hormone is being produced inside the cells of thyroid gland, and basically the epithelium of these cells is a place where thyroglobulin is present, and it is being iodinated to produce T3 and T4. Now, when the cells or the thyroid gland is suffering from disease, there is the hypersecretion or there is overactivity. Obviously, the structure of the epithelium or the morphology of the cells will be altered. So here in this section, we will study that what is the morphological or pathological changes that can be observed in the cells of the patient who is suffering from hyperthyroidism. Now, the first and the foremost thing that can be observed clearly is the hyperplasia. Now, as the patient, the patient is suffering from hyperthyroidism, and there is excess level of the hormone that is due to overactivity of the thyroid gland. That means the cells of the thyroid hormone, they are overburdened and they are in hyperplastic state. They are producing high level of the thyroid hormone. They are working beyond their capacity. So this will cause the hyperplasia of the cell, and that is known as the papillary hyperplasia. Now, this hyperplasia can be a prognostic factor for the cancer or carcinoma. Also, this papillary hyperplasia, it can also be confused with the papillary carcinoma. Both are if you look at the pathological images, they are almost similar. But the differentiation or the differentiating point is that the nucleus in case of papillary hyperplasia is visible. It is hyperchromatic and can be seen easily. Whereas in case of papillary carcinoma, papillary cancer, the nucleus is not visible and it cannot be seen within the cells. Then lymphocytic filtrate can be there in case of diseases like that are under the influence of immune system, or there is autoimmune diseases. Then there can be the B cells can be observed, T cells can be observed, and other such cells can be present within the cells of the thyroid gland or in the lumen as well. The lymphocytic filtrate can be seen. Then the third thing that should be observed in the patient, in such patient, is the tall columnar epithelium. Now, usually the epithelium of the thyroid gland cell is not tall, but when the hyperplasia occurs, or when there is a hypersecretion of the hormone, this causes the change of the epithelium of the thyroid gland cells to the tall columnar cell, and these tall cells can be observed here easily. And then when the patient is treated with antithyroid drugs or when other treatment options, these tall columnar epithelium changes to the cuboidal epithelium. Now, that is totally depending upon the hyperplastic condition of the cells and the secretion of the thyroid hormone. Another thing that can be observed or that is the prominent feature is the colloid. Colloid can be seen in the lumen, and there can be this scalloping of the colloid that can be observed in the patient of the hyperthyroidism. This here in this diagram, it is represented with this pink color. This is indicating the scalloping of colloid. So these are some important and the prominent features that can be observed in the patient or in the cells of the patient who is suffering from hyperthyroidism.